you got to make sure you got to do your blood pressure. You've got to check for diabetes, and you've got to do sexual health screening, mandatory. So if someone sees you in the clinic, it's irrelevant. They don't know why you're there. All they can think is that you're going there for your regular MOT. And the other thing is that there are different ways to test now. So yes, you've got sexual health services, which are really important spaces that you can not only test but go and talk about what you're experiencing. But you've also got online testing as well. So you can get free online, you can go online to different platforms. And if you look in your local area and you just put sexual health remote testing or online testing, you can go on the NHS website. It's better to know than not to know. And so that everyone can live the best life that they can.
I apologize, NHS. You might have a surge after people watch this video, yeah?
Sure. Affinity Xtra. Be extra.
Hey guys, this is your boy here, Roger Moore here on Affinity Xtra, celebrating gospel music of black origin. Now, you're on the Edge Show. We're doing a special series in partnership with the NHS. That doesn't mean the NHS is bought by mouth, but we're going to bring the professionals in who are going to make a informed, educated opinion, which is real important. And again, what's really amazing is seeing black professionals from the NHS coming in and explaining, taking out their time, their personal time to have a conversation so we can all be liberated by knowledge. So I'm on this today with Dr. Vanessa. I'm going to get this totally right. Apea?
Perfect. It is perfectly right.
Guys, when I check my DNA, I'm sure I'm gonna be Ghanaian. You know what I mean? That tongue is it flows. It's flowed sweet there. You know, it flowed so sweet, it's unbelievable. But we are going to be touching a subject where I apologize if you're watching a video. You're going to see variations of reds on my face because we're going to deal with a subject which, unfortunately, we are not very good at talking about in our church communities, but. We need to talk about this because it's affecting us and we need to be talking about it from a more holistic area. So sorry if this offends any of you, if you feel like we shouldn't be talking about this because you believe in abstinence, but let me be real with you. Abstinence ain't going on too tough right now here in the church hood here, because it's I'm afraid people are taking a bit of the mick, and I think that we need to be teaching from our platforms what is going on out there, and that's why I'm here with Vanessa here to go through this. Now, sis, can you please explain who you are, your background, and get into what good sexual health is?
Yeah, no, definitely. Firstly, thank you for having me. It's great to be here. So I'm Vanessa Apea. I'm a consultant in sexual health and HIV, and I work in East London. And I also do research looking at race, gender and health, and how all that can be come together to give different people opportunities to have good health. So it's great to have these conversations. And I love my job, and I'm very clear that as a black woman and as a black doctor in this role, I think that these conversations are so important because we find that many people in our communities, we don't like talking about sex and we don't like talking about sexual health. So I think, you know, you said to me to kind of talk about what sexual health is, and if you look at some of the definitions about it, and you start even from, like, you know, the World Health Organization, they state that, you know, sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. So it's not just about not having a disease or not having a problem. It means about being healthy. So things about you and sex, it needs to be healthy. It needs to be a positive. And within that, I always talk about the fact that it's not just the fact that people are having sex and having relationships, it's how they're having it. So it needs to be really positive, it needs to be respectful, and it needs to be free of people forcing anyone, any discrimination or any violence. So it's positivity about sex in its wholeness. And that's what we do within sexual health services. And it's really important that, you know, part of life and part of health is about sex, and you can't really separate it. Whether you're actively having sex or not, it influences your life. So it's important that we need to be educated about it. Yeah.
No, 100%. And I think I don't know what it is. Yeah, it's a hard thing to pass on. You know when you're talking, I'm thinking my dad's talk. I think it lasted about 30 seconds. And not even 30 seconds. He just because everybody looks at it's either from your school or directly from your parents. Anything else, is what you pick up, almost like bad habits. And the problem is within our communities, our parents are not very good at it. Let's be real. And our schools now, we are actually, from a Christian perspective, we're not happy about what they're teaching exactly in there still. Yeah, so we almost are not comfortable and coming against aspects of sexual health and how they're teaching sexuality at schools. But you're almost throwing everything out. It's throwing everything, the toys in the bath, the child in the bath. We're just throwing everything out, not realizing there's elements that are still correct and promotes good health.
Yeah.
So when there's these two sides. You've got good health and poor sexual health,
and that's the thing is that as within society we've got really it's either on one side of the spectrum or completely on the other end of the spectrum.
Cool. Yeah.
And there's no in between, and we don't allow for people to talk about different things that may be going on with their life that may affect how they are, how their sexual health is. And so when I talk about poor sexual health and not having a positive experience can be a whole wide range of things. So it can be an unplanned pregnancy, or the fact that because of an unplanned pregnancy, you have to make some choices about whether you want to continue with the pregnancy or not. It can be that the psychological consequences, that if you've been forced, if you're in a relationship that you're being forced or you're being abused, that all is within poor sexual health as well. Wow. And that shouldn't happen. And then you have infections. And, people often talk about HIV alone. And, it's great because we're going to be talking about it. But there's a whole host of other sexually transmitted infections: chlamydia, gonorrhea, warts, herpes. There's a whole other ones as well that can affect your quality of life. And some things like, if you do have infections that are left untreated, you can get things like pelvic inflammatory disease in women, and that can cause difficulty in pregnancy. So it can cause difficulty in getting pregnant, but then also staying pregnant as well, and things like ectopic pregnancies. And then you have other things like liver disease, so hepatitis, some cancers like cervical cancer, recurrent symptoms. So it's a whole host of things. And I think the way I talk about it is that you've got a whole host of ways that your sexual health is poor and there are difficulties with it, and you've got a whole host of ways that your sexual health is good. And it's not for us to judge either or the other, but it's just to say that we need to be aware that it's a spectrum and it's not just one or the other. Yeah.
Beautifully, really get your point there. That's actually got me thinking a bit there. 100%. So okay, then, right, this is a black community conversation. This is the straight to black community. Now, we're sick and tired of hearing, okay, we're disproportionately affected by diabetes, we're disproportionately affected by kidney disease, we're disproportionately affected by strokes, we're disproportionately affected by COVID, we're always disproportionately affected. Is sexual health another one?
Yeah. It is, but when we talk about disproportionately affected, and it's funny because I do a lot of community outreach, and there's always someone in the front who's like, enough, I don't want to hear it. And I always say, no, we don't want to hear it. But what is really important is that when you hear those words, it's not about blame on you. Okay. It's about acknowledging that the systems, the policies, the environments that we are growing up in, that we're exposed to, are not giving us the best opportunity to have good health. See?
Okay, I got you.
Removing that responsibility from us so that it doesn't feel so negative and oppressive on us. Because I think it's right, because you're right. You know, you see inequalities. I mean, that's all I talk about. And it can be draining to hear it. But going back to specifically to your question, you know, is it in sexual health as well? Yes, it is. Wow. So what we do see is that in a number of sexually transmitted infections, such as gonorrhea and trichomonas vaginalis, we do see significantly higher rates amongst Black communities. And we can talk about HIV as well. And we do see higher rates in certain communities as well. But for me, it's about why is that? You know, and I think there are a number of things that are related to that, and a big part of it is stigma. You know, because we. So when I say we talk about we as Black communities.
Yeah, Black communities, 100%. Yeah.
We like we said, we don't talk about sex. We may be having relationships that may be putting us at risk, but we don't even know about it. And the problem is that because of that stigma, it stops us seeking more information or asking or going to clinics for regular testing and things like that. So that can be part of it as well. But for me as well, I always say that services need to make it easier for us to come into. We also need to see ourselves in conversations and see ourselves in imagery, not just that you say we're negatively affected. We need to be brought into the whole conversation. We need to have you know, when you've got the leaflets, it's little things, but I think representation is really important when you are doing community outreach, when you're doing social media assets, when you are giving out information. Come to where we are. Come to our community places. Don't expect us to come all the time, because we're not able to. We're not doing that. So we're not going to have the same access to the information that everyone else has. So then we may not know the best. We may not know some of the best decision making. We may not know where to go. We may not know where to access the care that we need. So I think it's really quite complex. But we are more affected in certain infections.
Wow. Okay, here's one for you. And a new phrase for everybody now is bisexual. Like, everyone's stammering before they say bisexual. And unfortunately, them actions of bisexuals being prevalent. And I'm saying this, and I'm being raw with people out there who are Christians. That's been prevalent within our communities, within our Christian communities, for a very long time now, and we cannot pretend like it's not going on. You know, I've had conversations with people who know of leaders and ministers who've been involved in activities. So I'm not having it. You're not going to be slating me here. This is just some real talk conversations out there. But the problem is, because it's so undercover, it makes them almost die in darkness if there's something health-wise is affecting them. But also what I would say as well, from feeding back from what you're saying as well, is our music promotes how we perform sexually. Best, you know, and we almost perform like we just there to just follow our lust. And when I see what we're saying in our music, having a baby mother, having children here, there, and everywhere is not normal. I play with a lot of footballers and young men in the community, and you got young men who got 3-4 different baby mothers before they're 23. 24. Is that the things that we're going to be lifting up? I'm saying it does happen. Yes, we know it does happen, but it happens a little bit too often, and there seems to be it doesn't seem to be a kickback against it. And you don't know if that person could be easily spreading any sort of disease around there, which are affecting the baby mothers and affecting and they can't have any children in the future. These are just real implications, guys, of our actions that we don't locked down, you know, within our community. You was gonna say something, Vanessa? Sorry.
No. I was agreeing. I think you're calling out really important issues, and I think that often people feel uncomfortable talking about it, which I understand, but they also it's about who's talking about it. When it's ourselves talking about it, I think we need to take that leadership and have these frank conversations. Because when someone else tears that conversation, that's when we shut down. And we say, how can you tell me about that? Don't talk about my lifestyle. But I think that you bring up some really important points, is that we keep a lot of things in darkness, and also that we don't have forthright conversations about the implications about certain behaviors. So if we are going to have multiple partners, there's a responsibility about multiple partners. It is about protection. It is about regular STI testing. It is about the fact that if you are having multiple partners, you've got to tell the people that you're having multiple partners so that they can also protect themselves. So it's not about dictating what you do, but it's making sure you do it in a way that protects everyone. And I think these are the conversations that we need to have.
Oh no, 100%. Now, here's a line which is probably an ignorant line, but something that I was back in my head now. Now, I grew up in I'm born in the 70s, grew up in the 80s, 90s, and all of a sudden this thing came out called HIV/AIDS. Oh, we looked at the gay community and says, "Eee!" We pointed at them, and then there was a massive clampdown on sexual health. This, condoms became very popular. It came out their shop, and everything was about HIV/AIDS and how do we stop it. And the talk was, it started from Africa. Then there started being a talk, it's a created disease that goes against Africa, and there's a lot of kickback against it. But I must admit, over the past 15 years, I haven't heard nothing of it. So have we eradicated HIV and AIDS? Because I don't really hear much people talking about it anymore. Or is there a cure? Because it was when I was younger, it was all about that they couldn't cure AIDS, and I had no clue about HIV. So could you just kind of update us where we are?
No. Yeah, I'll go into it, and so if I start from the beginning, first of all, so HIV it stands for human immunodeficiency virus, and that's a virus, and that's a virus that can damage your immune system, and so it puts you at risk of everyday infections and rarer infections as well. And so and when we talk about AIDS, that's something different. So it's an acquired immune deficiency syndrome, and that's the name that is can be a number of potentially life-threatening illnesses and infections that happen when your body is affected and severely damaged by the virus. So you have the virus, and if you have it for a long time and it's not treated, it can cause AIDS. So it's something different. So just because you are living with the virus does not mean that you have AIDS. So that's one thing. And the key thing is that you can't pass AIDS from one person to another. It's the virus that can be passed between people. So
that's dangerous. That is, jeez. So HIV can spread.
Go on.
So HIV is spread through sexual activity. Correct me if I'm wrong. Or you know what I'm saying. But it's not dangerous only if it's not treated over a long time, and then it goes into full-blown AIDS. So you cannot start off straight away and just say, I've got AIDS. It has to come from a foundation of having HIV.
Exactly. Okay, and one of the things is that there is no cure for HIV at the moment. So there is no cure, but there is amazing treatment out there. And so you've got amazing treatment, which means that someone living with HIV can have the same life expectancy as someone not living with HIV. Someone living with HIV can go on to get pregnant and have a child that does not have HIV. And also, someone living with HIV, if they are on effective treatment and the virus level in their body is really low, which we call undetectable, they cannot pass the virus on. So they can have sex with someone and cannot pass the virus on.
So hold on.
And so how do you get
pregnant and not give the other person HIV. So what you're saying, 2 HIV people can have a child and them not have HIV, or are you saying that people? Because I assume if you got HIV, you can't do any anymore. You just have to sit down and smile, yeah, because you're gonna spread the disease. But you're saying,
I'm saying that's not right.
Okay.
Yeah.
I'm learning, guys.
And that's why we're having this conversation, because it's really important, because like you say, in the 80s, we had these there were these tombstone, I can see my parents showed me, there was like tombstone leaflets that were sent to people's houses, all you saw was HIV, AIDS, death. And that is not the case now. So for me, when I see someone that's living with HIV and they die from advanced disease, I am devastated, because that should not happen, because we have access to great treatment. So the issue is that the earlier that you take treatment, the better. But what happens a lot is that people are scared to go and get tested, and they get diagnosed late. And the later that you get diagnosed, the more risk of having more complications, and the higher risk of death from HIV. But if you regularly test and you pick up the virus early, you commence treatment early, and that can mean that you can have a long, fulfilling life.
Wow, and I think that great, and I just want to apply that to even like life scenarios. We're looking into our communities, which is very silent about having affairs, sleeping around, guys, and the implications for that is almost you doing things in secret. Because if you see Roger at a if you see me at a Xtra health clinic, they're gonna be, what you been up to, mate? You know what I'm saying? So you've got that kind of like, you're mad, like, doc, I can't go there. I gotta so you got that embarrassment factor of going into a sexual health clinic, but you can't. But you want to carry on with your dirty behavior, if I would call it that, you know what I mean, and whatever. And you got to take responsibility for your actions, as I do say, and you be irresponsible. And other young, from my position, would be young women, but other people, whoever you desire, gets infected as well, and you just get this spread of disease, and it just affects and it destroys the community and exposes people's lives going where future-wise, where you might just get the treatment and get sorted out and live a long life, but the person who you spread it to, because their dad's a pastor and I couldn't say nothing for about 4, 5, 6, 7 years, end up AIDS and die. And
I think that you brought up a number of things there, because the issue is that I would love for sexual health screening and testing to be part. I always say this, your health MOT. So each year you've got to think about things that you need to do, right? So depending on your different ages, but let's say like you got to make sure you got to do your blood pressure. You've got to check for diabetes, and you've got to do sexual health screening, mandatory. So if someone sees you in the clinic, it's irrelevant. They don't know why you're there. All they can think is that you're going there for your regular MOT. And the other thing is that there are different ways to test now. So yes, you've got sexual health services, which are really important spaces that you can not only test but go and talk about what you're experiencing. But you've also got online testing as well. So you can get free online, you can go online to different platforms. And if you look in your local area and you just put sexual health remote testing or online testing, you can go on the NHS website. You will see that you can access sexual health tests online. They can be sent to your home. You can do it in the privacy of your home and then send it in. So there are different ways to access testing. And so for me, it's like, we've got no excuse. We need to really encourage each other that it's better to know than not to know. And so that everyone can live the best life that they can.
I apologize, NHS. You might have a surge after people watch this video. Yeah, a massive surge. Like it's going, whoa, inundated from certain certain areas of the community. Going, hold on a second, they never asked for us before. But that's fantastic, because, like I said, we're very proud and set of people. Very proud and very private sometimes as well. Always thinking about what other people think. To our own detriment. Yeah, and that's not only in other areas of our health, but also especially probably even worse than ever in terms of our sexuality, in sexual health. So that's fantastic, and it's not fantastic to know that HIV is still about there, but it's fantastic that we got treatment, because it was a lost cause in the 80s and 90s. It was like a death sentence, and it was a massive thing, and there was always saying in Africa. I remember when I went to Nigeria in the early 2000s, and I had massive posters, about HIV. 1 in 4 or something silly. I can't remember what it was, but it was a very high rate, something I've never seen before in Europe. Like, is it still going on? In the African nations, actually, touching base about in Africa, is it still a major? I know it was a major issue going in up to about 10 years ago. Is it still something which the communities are still dealing with there?
Yes, definitely. And I think that one of the issues that is that not all countries have the same access to treatment that we do. So we have got free treatment. So regardless of your immigration status, you can access HIV treatment. And we are very privileged within the UK. There's a lot of work there's a huge commitment to end HIV transmission in England by 2030. And that comes with a whole host of interventions. And part of that is making sure that everyone living with HIV in the UK is diagnosed and given treatment, and their treatment is optimized so that their viral load is undetectable and it's suppressed. But unfortunately, that's not the same globally. So if you go to many countries, I'm originally from Ghana. I can talk that, the access that we have here is not the same there. And they don't have the same range of medications there. So there is a lot of work to be done globally to make sure that there's equity, so that each person, wherever you are, whether you're at risk or you're living or you're affected by HIV, that you get the support that you need. And again, one of my I think the most important topics is stigma. So the stigma that we experience in the UK around certain conditions can be, exponential in other parts of the world. And the thoughts and the negative connotations about HIV are really palpable in some countries, and so that is a big challenge for us all to question ourselves and our judgment and how we treat others. Yeah.
Okay, no, 100%. And as you're going through this, I'm kind of like, I'm learning a lot, and I really see how pride, inability to have conversation in terms of sexuality, has really, if you can't talk about, your sexuality, and I'm not going to use the word struggles, your desires or your thoughts, or you can't sit down and say anything within that environment, let alone in a sanctuary that's supposed to be a safe place. How on earth do you bring up that? Oh, by the way, imagine you're coming into and you got HIV. How do and everyone wants to talk about healing? Like, I got COVID, pray for them. Oh, you've got diabetes, pray for me. I got HIV. Huh? You know what I'm saying? It's like, it's a different. Don't even play, people. You know what I'm saying? If somebody came in and gave a testimony, I got HIV. And God's giving me healing, and I'm living with it now. He'll be the person getting crossed off all them lists out there still, and people don't want to come out there because of sit over there because I don't want to get any, I don't want to get anything.
It's so painful because that sadly there are many spaces where that doesn't happen, and there are many spaces where that does happen. And and when I see it, when I hear of it, I find it so painful because it's like you said earlier, HIV is passed on through sexual transmission. It's passed on through fluids. It's passed on through blood. It can be passed on through breast milk, but it's not saliva, urine, sweat. It's not that. And so just because someone has opened up their heart and told you what is going on in their life, and you're standing near them, you give them a hug, you kiss them, you will not get HIV. And But what you will do is force someone to live this dual life where out in public, no one knows anything, but at home, they're there crying, they've got no support. The only support they have is in the clinical setting. And that shouldn't happen. You know, our communities are powerful and we need to use that power to support people. And as I keep saying, to live their best life and to, and as we all go through different crises, to say you are part of it. So it's so important to talk about it as we are.
That's crazy. You almost caught me out there when you said two things now. So we're looking at transmission because in this, so we get all the fluids go, you know, straight away, don't kiss them, don't even go, you don't even think about doing anything else, and it's not about trans. But then, okay, the first one is, you said something about mothers. So hold on a second, I thought, so what you're saying effectively is, it's only through the breastfeeding how the child gets the HIV from the mother. Is that effectively what you're saying?
So just to clarify, you can get HIV through semen, vaginal fluids, anal fluids, blood, and breast milk. Yeah, you can get that. But first of all, when someone is living with HIV and they're pregnant, they go on to treatment so that they reduce the level in their blood, so that they do not pass it on to the fetus, don't pass it on to the baby. And also there is interventions that we do. It's more complex, but there's different ways to make sure that either you don't pass it on through breast milk or that we don't encourage it. So there's it's different scenarios, but there is a possibility there. But with treatment and the interventions that we have, the risk of someone passing it on to their child is negligible.
Okay, cool. Yeah, okay, brilliant.
And that's amazing.
Yeah.
We have come so far.
No, because that was a major problem where they got two parents who had AIDS. The children are they call them HIV babies and so on like that. And there was and that and they've got HIV themselves. And they said, what life have they got forward going forward from that? And you're like, oh, you know what I mean? That's what we saw in the 90s, like on the TV screens. Right, something is interesting actually. We're having this conversation, and I watch a lot of FBI programs and whatsoever. And I remember this guy was chasing down some people because they looked back historically. Something called screening came up, and before screening happened, they said their son got contaminated blood. That had contaminated, that had HIV in the blood and contamination. Reason why I said to bring this up, because the importance of, this is screening element, and I know there was a very scary part in the 90s about giving blood and blood transfusions, because that's part of treatment. And obviously we're saying bodily fluid. He said sharing through needles and syringes and stuff. But if people are giving blood, and homeless people in America were getting paid to give blood, and this is the problem that they're having now. Just explain the details about that one.
Yeah, no, it's a really important thing to highlight. So yes, if someone is sharing needles and syringes, that could be a possibility of passing on HIV. But in blood donation and in blood transfusion and receiving blood, and also in donor giving any organs, etc., before the person is allowed to give blood, etc., they have to go through certain screening. So there are certain blood-borne viruses, we call them. So HIV, hepatitis, etc. These are all tested for before the blood is used for anyone. And so it's really important. So yes, there were some really difficult, unfortunate cases that happened in years gone by, in which the screening procedures, as you say, were not optimal, and other reasons. But we can be assured now that when we go to give blood, when we do donations, when we go to receive blood, that precautions have been put in place to ensure that there's no transmission. Good. And I'm just really glad that you've highlighted that, because there is such a big drive for our communities to get out there for blood donation and to be part of it. And so I would not want anyone to think that there's a risk of you getting infections. It is screened, so that does not happen.
Okay. No, that's great, fantastic. Because you do see hepatitis, and they actually say hepatitis or HIV. They say it's got through, and my son got it through. Or the child get it through that because I had a car accident and so on. And just in case people go away scared now, really scared of thinking about, oh my gosh, I could get it through a blood transfusion. Right, you keep mentioning about the amazing treatments that we have for HIV, because I want to really emphasize this, because we potentially have HIV people with HIV in our communities, and we almost keep them. We would pen them in. I'll be honest with you, if people admitted that in certain environments, we almost take a step backwards, because it's almost a case of, we've seen it in COVID gave an example how we operate when people have something that we don't desire to have, and that's just the human defense mechanism. You step away. So there's a lot of education that needs to happen with that. But you're saying that people can live a full life with HIV. How would you encourage somebody who has got HIV? Who knows they're in an ignorant environment within our communities? I'm not saying they're bad people around them, but just ignorant towards the risks that they have. How do you, as a doctor, encourage them how to move forward? Because you're treating them and they're getting, in inverted commas, better. But how do you treat someone who's maybe in their 20s, got HIV, staring at another 30, 40 years of life being in the closet? So how do you do that?
And I think so. First of all, for me, when I'm speaking to someone living with HIV that, as I say, is living this dual existence where no one knows, I first of all, I talk about the importance of knowing their own value, because you see what stigma does and what negative behavior around you does. It makes you question your own value and who you are and what you deserve, etc. And so for me, that is a big crux of the conversation that I have. So I say that HIV does not define you. It is something that you are living with, and we will talk about how you manage that, but it does not define you. And part of my role is working with you that you are as healthy as possible, and you are enabled to live the life that you want. And I think that's crucial. I think the other thing is being really clear about challenging their own internal stigma, because
true.
They will be there thinking we've all got our own internal stigma about everything. And then so you're there and then you're thinking, actually, is there good treatment? What is going to happen to me? So for me, education is really important. I always start at the basics. I don't make any assumptions about what people know, whether someone's newly diagnosed or, I like to have these regular yearly conversations just saying, so where are we at? What is your understanding about HIV? Do you know? And just remind people that the treatment is there. And if they're not tolerating the treatment that they're on, there's other treatments to give. But actually, generally where we've come now, people tolerate treatment extremely well. I let them know that their research is always happening, and so at the moment we're doing research on longer acting treatment. So instead of you taking treatment every day, you may take an injection that you take every 2 months. Okay, treatment is really evolving. Brilliant. And then I talk about relationships, and I let people know about what we have within the clinics. So most HIV services will have psychologists, pharmacists, but what's really important is peer support. So access to other people living with HIV that that they will understand and give that support, whether just in the clinic but also in the community as well. And there are fantastic organizations across the UK that their whole focus is to make sure that someone living with HIV is given the support that they needed. I would emphasize that they are valued. There is great treatment out there, but there's also a network of support outside of their own, close networks. There's a wide network of support with organizations as well.
That's fantastic, because it feels like it's a death sentence. Like, as a 20-year-old, you got HIV, and you're like, oh my gosh, I can't even meet somebody, I can't talk to nobody. I've gotta just have a life with no relationships for the rest of my life. I can't think of no more family, no more. It's all these thoughts are hitting them, and it can lead somebody to suicidal. It can lead people to be very angry and bitter to the person who's given them the disease.
Exactly, and a good life with everything that you said in terms of job, family, opportunity, good sex, it's all possible.
Wow. Okay. Yo, guys, that's an interesting one. That's a lot. Is it? Is it sure? And obviously, this has been told to us by the doctor, not by somebody who thinks and knows things. But obviously, this year there's been an announcement. There's been some big things happening in the UK. So not only NHS not only investing into long COVID transmissions and let's say long COVID centres around the country and throwing millions, but they are still investing into targeting that 2030 zero effect of when it comes to HIV and AIDS. So explain to us, what is the zero transmission kind of mentality? How are you approaching it? What's his investments, and how does it look? How does it look to us on the streets, as they would say? We're just walking around. How does it look to us?
Well, so the key aim is that we want no more HIV transmissions. Okay. And zero HIV transmissions. And to do that, we want to make sure that everyone that is living with HIV is diagnosed. So people get tested and they get diagnosed, and then they're supported to go on treatment, and they stay on treatment. And then we also want people that are at risk of HIV. So whether having unprotected sex, being in certain risk groups that are at risk of HIV, that they are supported to stay negative. And there are a number of ways to do that, and I can go into that. And the NHS England has invested a significant amount of money, as you say, to support different interventions to get to zero, because that's all we want to do. And there's other initiatives. Some people may hear of things like Fast Track Cities initiatives, and it's about bringing different organizations together, community, NHS partners, people living with HIV, to come together to design interventions so that we can reach this zero transmissions. And so one of the examples is that to really increase earlier HIV testing and diagnosis is that in emergency departments in London, in Manchester, Brighton, Sussex and Blackpool, I think it is, there's routine hospital blood tests that will include testing for HIV. And so that it gives people it gives services a way to discreetly identify undiagnosed people and then give them the support that they need. So because if they're not going to test in sexual health services and other with their GP, it's a place that, it's a safe place to do that testing. So that is being done. Pregnant women are offered routine HIV testing, so it's opt out. So unless you say you don't want it, it's routinely done. We do a lot of routine HIV testing in, like I said, in the hospital emergency departments as well. So there are many layers of initiatives that are being invested in so that we can support this reaching zero. And I mentioned ways of staying negative. So as you said, everyone likes to talk about condoms, but is everyone using condoms, etc.?
Yeah.
And we've got to be real about it. And then the same time that we say people don't have sex, but people are still having sex. And so there are also other medications that are available that people may not know about. So if someone has had sex with unprotected sex and they are told the person is living with HIV, or they're concerned about the risk that they've been exposed to, they can go to A&E or a sexual health clinic. And if they go within 72 hours, and if after the conversation it's felt that they are of higher risk, they can get access to treatment that stops them acquiring HIV. And that's called post-exposure prophylaxis, PEP. And so that's really important. And there's also something called PrEP, which is pre-exposure prophylaxis. So this is a tablet that you can take, and depending on your gender and sexuality, you take it in different ways. But essentially, it's a tablet that you can take before and after sex to stop you acquiring HIV. So, for example, if someone is living with someone with HIV and that person has just been diagnosed, or they're on treatment, but they're not yet fully suppressed, and their partner, they still want to have intimacy, then their partner can go on PrEP, and that will stop them getting HIV. So there are so many ways that are available to everyone to make sure that there are no further transmissions of HIV.
And, if you're thinking, okay, Roger, you're promoting this information so people can go wild, this is not what we're trying to do here, because I think that, one of the counterbalances towards lack of knowledge and people not going forward is because they think their life is over if you find out. And sometimes we don't want to look at our back and look at the wound on our back in the mirror, because we know the implications on our life for it. And I think, and this is really a serious appeal now. I know it's a very touchy subject, because it's almost a case of you going against what you're saying. You got perfect brethren, perfect lifestyle within your church settings. I'm looking at religious settings because it's something which we don't want to seem like we're promoting a behavior which our Bible doesn't really preach. But what I would say is, I don't know what percentage, but there is a percentage within our buildings are not living that lifestyle. Let's be real. And it's important that we were part of this zero trans. I don't know how it will look in our spaces where we said one partner for life. Like that's the best way to do it. One partner for life, and you behave yourself all this life. But as I get older and wiser, yes, when I'm 18, 19, yes, we just get married and that's it for one life. I've learned that it hasn't really worked out that way for a lot of people within and it's affected people in diverse ways. Men do cheat, women do cheat. You know what I mean? Let me be just straight about it, and we need to push for this. I know there could be implications. People start questioning, how did they get the disease? Who did they get it from? And whatsoever. There's a lot of things there. But the problem is we need to be part of the move to do it. How that looks, I don't know, ministers. No, I don't care. I don't know religious leaders. I don't know how we're gonna do this one. It's a very dicey subject, but something, having this conversation with Vanessa is something that's really in the back of my mind. We need to be part of this conversation and the move to push towards screening within our spaces, being part of the movement, encouraging it. I know people go, Roger, no, but we need to be real about this subject and what's going on in our places. Yeah. And what's going on in our places, if anything, AIDS will probably develop more in our spaces just because of our ignorance. And people are dying. Children are conceiving HIV because no one wanted to get tested. They don't want to get embarrassed at when we first go for the testing when the young lady gets pregnant. No, she ain't got it. I'm telling you, no. How do you know? So it's these little things helps the next generation and helps this generation, and we want to be part of this 2020-30 going, yes, it's eliminated in this country. But we want to close off. I know that was a tough one. I thought I had more red cheeks. Instead I've been, really? Yeah. So I'm happy, guys. You know, so sexual health isn't as red faced as I thought it would be. One more point I want to talk about. Something I did a video about this, guys. I'll be honest with you. I did a video and I complained and I was angry because I grew up around I grew up looking in the history books about smallpox. You know, I grew up in history looking into chickenpox. And then straight out of Africa, we have monkeypox. Now, sorry, Dr. Vanessa, I kicked off because first of all, they said that African people look like monkeys. And then you're going to say that the only animal you could pick from the millions of animals, they couldn't even call it elephant pox. Yeah? Why did he call it monkeypox? So that put my guard up. I ignored it, another foolishness, and I walked away. Yeah. Now, did I do the right thing?
Well, you know, but I think it's, again, I always say it is really important, the kind of thought process that you went through, because that is what many people went through. Many black people went through that. Just saying, I don't even want to know, because all I know is that you said that there have been a lot of cases in Africa before. You called it monkeypox. Again, you're stigmatizing me. Again, you're devaluing me. I don't want to know. And so I completely get it. But I think that we're talking about everything, it's important to know what it is and to understand the relevance of it. And so first of all, so monkeypox is caused by a virus which is a cousin of smallpox, first of all. But the issue about monkeypox, and the reason that it has been called monkeypox, is because when the first time that they were doing the testing and found it was within monkeys. And it grew within monkeys, so that's why and I think it was macaque, don't test me on that, but it was a certain type of monkeys, so that's where it came from. And I'll talk about how it's passed on, etc. But I think, picking up on your point, many people have talked about this in terms of how stigmatizing and othering the term is. And so there's a movement about changing the name of it, because you know, in my mind, you know, before when I was saying that when we talk about people that are disproportionately affected, and often we have to take the responsibility, it shouldn't be. It should be others kind of making life easy for us. And I feel that it should have been preempted that this would be stigmatizing, and different names should have been given. So I think that, but it's complex, and it's not one individual, it's not one country. But it is a cousin, it's a virus, and it was seen in monkeys, and it's a cousin to smallpox. So the issue is that for many years, we've known about monkeypox, but it hasn't been in the UK. We've had very, very small cases within the UK, and it's mainly been in sub-Saharan Africa. And it's the large cases in Congo, Nigeria. So and Cameroon, we knew of it, but because it wasn't affecting the UK significantly and the global north significantly, it wasn't really talked about. But then we saw that there were increased cases within the UK, and the issue was that they weren't related to travel. So it wasn't someone that had been, let's say, in parts of Africa and come over.
That's how it felt like.
It seemed that it was from the UK, it was from Europe. It was something new. And that was huge. And then the other thing is that we saw is that it can affect anyone. But what we've seen is that it has been affecting gay and bisexual men and men who have sex with men more so than other communities. So and that's been that's what we've seen more and more. But anyone can be affected by it. And essentially, it's spread by touching and close touching, a touching of lesions and sores of someone that has the monkeypox virus. So it's quite intimate personal contact. So it's not necessarily people just say, oh, so it's sexually transmitted.
No, it's not.
It can be passed on during sex, but it can be also passed on through kissing and hugging, etc., and sharing bedding and towels and clothing. So that's what it's important to make that distinction. Yeah.
Wow. All right, learnt loads there, right there from that. I've been had an educated guest when I did my podcast, and I had an informed education right now from doctor. So appreciate that, because when I put in monkeypox, to be honest, and when you said what does it look like, I had to just go back on the screen and on my computer, because it don't look nice at all. If I had that on my skin, I was like, it's not at all a great look. So it
looks like chickenpox as well. It can be worse than that, but it can look like chickenpox. And so some people listening may have gone in and said, I think I've got chickenpox, and then someone says, oh, we need to consider monkeypox. And I had a number of people thinking, no, why do I even need to consider it? But one of the things is that it can bring a fever, it can bring the rash and lesions that can look similar as well. So that's why. But it isn't pleasant to look at. Yeah. And some people can develop quite severe illness, but for most people it's mild and it's self-limiting, and people normally recover within a few weeks.
Okay, cool. So basically it's a different type of chickenpox and smallpox almost, But sorry, it's not related to chickenpox as such, but it's part of the pox. It look like it.
Because a lot of people don't know what smallpox looks like because it was eradicated as they've grown up. But if you when you look in the history books, you can see that it's all very similar. It's these rashes, lesions, and vesicles with fluid in it as well. That's the part I'm going,
reminds me of bad old days. So in terms of frontline, when it comes to monkeypox, obviously people don't want to go, so it's just a case of just going to your GP, or is your department's dealing more with this because of which departments do we go to if we feel that we've got this case? Because some doors are always, sometimes we're scared to go through.
No. So very important. So when if someone feels that they have monkeypox, they have symptoms, what we say is that you don't go straight to your GP, but actually you call your GP first of all and let them know, or you call NHS 111 to get advice about where to go for your local service. Because we are very mindful that it is infectious. So we just need to make sure that you are signposted to the right place. And we've worked a lot within each area of the UK to develop pathways so that once you call 111, once you contact your medical provider, they will advise you to go to the right space. So it's 111, your local sexual health service, but stay at home and contact them.
Wow. Because I thought it'd be like, okay, I'll be red faced at the end of this, and I'll be like, yes, we do have to be careful, guys. And you know what I mean? But it's been very informed, especially about the diseases. That I thought were out. I never knew HIV and AIDS was still a major concern and still a major situation out there. And monkeypox, I thought 5 people had the case and it's all done now. Obviously it clearly isn't. I know we could go in more. I'm sure me and Vanessa, we could carry on for another hour talking about these subjects. We're just so comfortable just talking to each other about this. This technically should have been about 20 minutes, but practically I knew it would go longer, and it's natural because we are concerned about our communities, and again, I know there's a lot of tough information in there, and there's a lot of moralistic tough questions that we need to really look at from a community standpoint that has been driven by Christian morals. Also, there's the opposite side for the creatives in the world. When you talk about sexuality and how you are and how free you want to be, look at the implications as well and what you're encouraging. Yeah. So we've got one extreme, and the other extreme do dominate our cultures. Yeah. And from whatever side you fancy you think you are, really have a look what comes out there. I look at flyers and events that just treat people's bodies like pieces of meat and encourages behaviors which unfortunately keeps sexual health clinics open like crazy 24/7, because of our behaviors. So I want to challenge our behaviors and the stigmas. If you feel like, you're scared to hear this, to get the results, there is support in the NHS as well for the stigma that's here, and so much more now than ever. But there is mental health support in these areas, and that's the reality of the situation. We don't want our people feeling down and alone, and there's people like Vanessa that looks like us, who's there to support us and know the struggle that we have within our communities. That's absolutely fantastic. Anything else you want to add to things, Vanessa?
No, thank you. No, I think it's. I think you've ended beautifully, and it's been great to be here. And I think that it's just important that we continue to have these conversations and recognise that we've all got to be part of changing what's happening in society, and our communities are really, really key to that. So we need to keep talking and keeping an open mind about so many different things, so that we can keep learning and sharing accurate information. But no, great to be here. Thank you.
No, thank you. Okay, guys, hopefully you had a good listen. Hopefully you're not there going like, I can't handle no more, this is too much overload, you know what I mean? But listen, there's information there if you want to do make comments on this here, keep it legit, but make your comments. If you like it, but if you dislike it, don't press dislike, but if you do make comments. We can do future shows to respond to some of your comments, so please make comments so we can go into it. But there are services there how to help you, to support you, and we'll have that information in the description 100%. Thank you very much, Vanessa. So thank you so much for your time and everything. All right then. Thank you, man. Blessings, people.
Hey, this is your bishop from Rock Solid. Thank you so much for watching us on YouTube. Thank you so much for clicking and subscribing, and also sending these videos to other people as well. We are so hungry to get your support. So remember, check us out on our website, and also check us out on Insta, and wherever you want to find us on Spotify. You can play us all day as well. And just make sure that you are supporting this channel, that we are developing our agenda towards music of Black origin, and that is gospel music with a message. So please walk with us on this journey. Bye now.